presentation, we're going to talk about anatomical terminology that you'll use every day in the lab. We'll go over planes of the body and directional terminology. So why is terminology important? Well, for one, it's just good communication. You have to have good communication in the lab in order to create the desired product for the patient. Good communication and good terminology leads to increased efficiency, less mistakes, and a better product for the patient. One of the problems with terms and vocabulary related to anatomy and physiology is that it was created at different times and they used different languages to create the words. One was Greek and one was Latin, and they do have different words and they pretty much mean the same thing. It's just that they're different languages. So a lot of times you'll find two names for just about everything in anatomy and physiology. The other thing is that a lot of these pathologies or maybe surgeries are named after the creator of the surgery or the person who found the pathology. So that can also lead to confusion. So in this presentation, we're going to try to stick with one, maybe two terms for everything, just to kind of simplify it and keep the number of words that we have to learn down to a minimum. So the first thing we're going to learn is anatomical position. Anatomical position is just the position of the body that you need to think of the body in when you're talking about anything to do with anatomy. It's very simple. I think you've probably seen this before in pictures and things, but the thumbs are out to the side, the arms and legs are extended, and just standing in a vertical posture. So this picture on the screen represents someone in anatomical position. This is good to look at and understand that position when you're maybe reading about anatomy, because whenever they talk about anatomy, they're going to be talking about a person in this position. So that's anatomical position. Now we're going to go over the planes of the body. We divide the body into planes, and this helps us talk about and find locations and define things in the body as we're talking about it. And those planes are the sagittal, the frontal, and the transverse. We'll start with the sagittal plane. The sagittal plane is viewed from the side, and it is like a plane of glass that goes straight through the body, front to back. So sagittal plane, front to back. If you wanted to view the sagittal plane, you would stand over here on the side of the person and look from the side. So think of this sort of as a screen or a projector screen. If you wanted to see the movie that was playing on this one, the sagittal movie, it would be viewed from this side. So that's your sagittal plane. This is also sometimes called the longitudinal plane. Not common, but sagittal is the most common term you're going to see. The next one's the frontal plane. So the frontal plane divides the body into front and back halves. It goes through the body side to side like this. So if you were wanting to see this movie, you'd look at the blue screen here and you'd view it from the front. So you'd be standing here viewing the frontal plane. The frontal plane is also called the coronal plane. So, and then finally, the last one is the transverse plane or the horizontal plane. And this is this green plane here that's like a tabletop. So if you wanted to view the transverse plane, you'd want to be standing on top or looking down on the patient. So the way I look at it is, have you ever been to like one of those big malls where they have the big open holes in the center of the second floor, and you can look down the people walking underneath you? That's viewing their transverse plane. Those are your planes of the body. And we're going to use these later on to describe the motions that happen in these planes. So we'll say things like sagittal plane motion or frontal plane motion, something like that. But it's good to know these terms, and it's just a real important piece to understanding where things are and finding things in the body later. Okay, there is a special plane. I'm going to back up here just a second. And if you look at these, all these planes are dividing the body almost exactly in half. So this is dividing top and bottom, side to side, and front to back on these three planes. However, in reality, those planes don't have to be centered on the body. They could be offset to one side over here a little bit, or offset to that way over there a little bit. So sort of like taking slices out of the body. We could move this side to side and it would still be the sagittal plane. However, there's one special plane that we use a lot in O&P, and it's called the mid-sagittal plane or the median plane. And that is the sagittal plane that runs directly down the center of the body. So this white line here represents the mid-sagittal plane. We use this for reference a lot when it comes to terminology of motion. Things are going to move towards and away from this, and we're going to have certain names that apply to that. So it's important to know the mid-sagittal plane. Sometimes it's called the mid-sagittal line when you're working in the field and actually fabricating something. So an important plane, the mid-sagittal plane. The body is divided into two major divisions that we like to talk about, and the terminology we use on those two divisions can be different, and so we have to understand the difference between the two. So we divide into trunk and extremities. So the trunk would be the head, the spine, the ribs, and then the sacrum, which is down in this area here. And so this is the trunk. And then we have our extremities, which of course would be the arms and the legs. So those two major divisions are super important to understand, because the terminology we're going to use later on will depend on which portion of the body we're talking about. So now we're going to get into our directional terminology. Directional terminology is basically northeast, southwest, left and right. So these are terms that you should become very familiar with. You need to have a good understanding of these terms, and really they should flow off your tongue just like northeast, southwest, and left and right does, up and down. We're going to go through all these now. We're going to go through anterior and posterior, medial, lateral, superior, inferior, proximal and distal, and then dorsal and ventral. So the first one's anterior and posterior. This is basically saying front and back. An easy way to remember this is that anterior starts with an A, and AM is in the morning, so the morning comes before the PM, or the evening, so we have AM and PM, and anterior is the front and posterior is the back. The next one is medial and lateral. So lateral is farther from the midline, so here's our midline, and if anything is away from the midline, that's lateral. And if things are closer to the midline, it's medial. So if we look at here, we could say that her eye is medial to her ear, right? And then we could also say that the ear is lateral to her eye. So things that are farther away from the midline are lateral. Things that are closer to the midline are medial. Then we have superior and inferior. Superior and inferior are only used on the trunk. So we don't use these on the extremities. Extremities don't have this term associated with them. Superior means closer to the head, and inferior means closer to the tail. I know we don't have tails, but we actually do have a tailbone called the coccyx, and so this means it's closer to the coccyx, and of course closer to the head would be superior. So inferior and superior are used just on the trunk. So we could say that her belly button is inferior to her chin, and her chin is inferior to her nose. Her eyes would be superior to her nose. So it's all kind of dependent on what structure you're referencing. So the nose isn't always inferior and it isn't always superior. It depends on what other structure you're going to be talking about. Now we have the extremities. So the extremities, instead of using superior and inferior, they use proximal and distal. And the definition of proximal and distal is closer to the trunk or farther from the trunk. So if something is proximal, like the shoulder would be proximal to the elbow because it is closer to the trunk than the elbow is. And then just the opposite, distal is farther from the trunk, so the fingers would be distal to the elbow. So distal means farther from the trunk, and proximal means closer to the trunk. The next terms we're going to learn are dorsal and ventral. And these are a little bit on the tricky side because, with the other ones, if you look at, let's say, anterior and posterior, everything on the front of the body is anterior, everything on the back of the body is posterior, and that makes pretty good sense. However, if we go back to this slide here, dorsal and ventral. So if you're thinking about dorsal, think about like the dorsal fin on a shark. So you'd have a shark fin back here on the back. That's the dorsal part of the body. And then ventral is on the opposite side. And vent, if you think about vent, it's an opening, right? So you have vents in your house where your air conditioning blows out of. There's more openings on this side of the body, right? So we have more openings on this side of the body than we do on that side of the body. So this is our dorsal side, and this is our ventral side. Where some of the confusion comes in is if we look at a person, one of the things that we have is the foot is considered the dorsum. So the top of the foot up here we call the dorsum of the foot. We also use this term on the back of the hand back here. And that doesn't really make a lot of sense because that is not on this is on the ventral side of our body. So why would they call this the dorsum? Well, the reason why is because you have to look at animals and embryology, where our body parts come from as we develop. And if you look at a dog, you can imagine that the top surface up here is the dorsal surface of the back. What would be the dorsal surface of the foot on this? What would be the top of the foot? So this would be the dorsum of the foot. So you kind of have to imagine a human being in that position, and then the dorsal and ventral things make sense. So the two things that are a little confusing is the top of the foot is a dorsum, and the top of the hand is also called the dorsum. You also tend to be hairier on your dorsal side than you do on your ventral side. So if you can think of a dog again, they have a lot less hair on their belly than they do on their back. And same thing on humans. If you look at your arm, you have a lot more hair on the dorsal side of your arm than you do on the other palmar side. So just kind of look at it that way. Okay, and then the final term we're going to go over, which is kind of a directional term, but kind of isn't. But it's a term we use quite a bit, and that's bilateral and unilateral. So bilateral means both sides. Unilateral means one side, either left or right. If you have a bilateral patient, you're going to be making 2 braces for them. If you have a unilateral patient, you're probably just going to be making 1. So bilateral and unilateral. This was just a real quick presentation on the different planes of the body, and then also some of the directional terminology you'll be using in the lab at all times. You really want to spend a lot of time memorizing this foundational stuff because you're going to be using this every time you build something, every time you learn something new. This terminology is going to be used with it.